Good afternoon. I'm Steve Rehorst, one of the public information officers with the Watertown Area COVID Task Force. Thank you for joining us this afternoon. As you've probably found out, we're doing these media briefings on an as-need basis, so we'll continue to update everyone when we are going to be having these media briefings. So again, thank you for joining us today. Up first, we are going to have Casey DeBoer, the President and CEO of Prairie Lakes Healthcare System, to speak about a healthcare update. And then he'll be followed by Mayor Caron, who's going to give us an update on the mask campaign. So up first, we welcome Casey. Thank you.
Thanks, Steve. Good afternoon, Watertown. The mayor asked me to come and talk about COVID-19 and what's happening related to that at the hospital, so thank you, Mayor. Today, there are 12 COVID patients, inpatients at Prairie Lakes. That number has fluctuated between 8 and 16 inpatients over the last 6 weeks or so. The last month has been very trying on our staff, as we have not only seen a high volume of COVID patients, but a lot of other hospitalizations as well. Today in South Dakota, there are 413 patients hospitalized for COVID across the state. The health systems in Sioux Falls and Rapid City are very taxed. Yesterday, between the two hospitals in Sioux Falls, they had 168 COVID patients, and in Rapid City, they had 69. These are the highest levels we've seen in the state to date. Hospitalizations for COVID in South Dakota are obviously at their highest levels. Those hospitals in Sioux Falls are at or near capacity. They are being very selective in the patients they accept, as they are trying to keep beds open for the sickest of the sick patients. They are requesting communities across the state to keep COVID patients in their community hospitals if they can care for them. In our region, all of the hospitals report hospitalized COVID patients. At Prairie Lakes, we have been fortunate to be able to create a special unit to care for all of our COVID patients in the best environment possible for them, for our staff, and for the other patients and staff in the hospital. Because of the increased hospitalizations in the state, many hospitals are again starting to curtail elective services to allow staff to be redeployed to care for COVID inpatients as those numbers continue to rise. We're not at that point in Watertown, and we're working hard to avoid that situation. At Prairie Lakes, our lab has been processing COVID tests since the beginning of the COVID-19 outbreak. Over the last 8 weeks, we've been testing over 300 patients a week. Other locations in the community are also testing hundreds of patients per week to see if they have COVID. In our lab, the test positivity rate for the last 8 weeks has averaged over 22%. So 1 out of every 4 to 5 patients that we test at the hospital comes back positive for COVID. Transmission rate is also very high in the state of South Dakota. The transmission rate tells you how many people an infected person also goes on to infect. The number in our state is currently greater than 1 to 1. So everyone who has the disease is currently infecting more and more people. With the high positivity rates and the high transmission rates in the state of South Dakota, the majority of the CDC modeling suggests that hospitalizations at the least remain at current levels for several weeks and most likely increase. These models assume that public behaviors such as wearing masks and social distancing stays as they are. The key statement there is that public behavior stays the same. If we can decrease transmission rates, we can decrease hospitalizations. So if more people will wear masks, socially distance, and follow the other recommendations, we can decrease the number of people who end up in the hospital. It really is up to you. When I see a person wearing a mask, I see someone who cares. My mask keeps my droplets off of you. Your mask keeps your droplets off of me. When you wear a mask, you're showing that you care about me and other people. The other thing I see when I see people wearing masks is that they care about the frontline healthcare workers who work for me and in other healthcare facilities across the community. When you wear your mask, that decreases transmission. When we decrease transmission, we keep people from contracting COVID-19. When less people contract the disease, that keeps people out of the hospital. When less patients are hospitalized with COVID, that keeps my staff out of the hot, sweaty, uncomfortable, claustrophobic PPE all day, every day, caring for COVID patients. And that saves my staff from being burned out and fatigued so they can be here and be ready to take care of you and the community and this region. We need the community's help. What you do matters. It matters to me, and it really matters to those frontline caregivers. And most of all, it matters to the patients who end up being hospitalized with this disease and those that are dying from this disease and their families and friends. Just this week, Prairie Lakes has lost one of your family, friends, or neighbors every day of this week. Please wear a mask. Show us that you care and help take care of the community. Thank you.
Thank you, Casey. Today is Thursday, October 29th, 2020, and the numbers are grim. In South Dakota today, 918 new cases reported. That brings the total number of active cases in the state of South Dakota up to 12,462 today. As Casey said, we have 413 people in the hospital across the state, and we've already lost 403 people in the state of South Dakota. We have 19 deaths in our state today that were reported. In Cottington County, we today have 341 active cases of COVID and 778 cases in our region. We know we're stronger together, and we can rise above this. We need to work together. We've lost 13 people in Cottington County, and that number, as Casey said, will rise unless we change our behavior. So we need to change this trend. We need to forget the politics. This is not a political issue. This is a public health issue. Don't shun others for their choices about whether to wear a mask or not wear a mask. We don't know what someone's story is. Maybe they can't wear a mask. But just look at yourself. If you can wear a mask, do wear a mask. We've learned that wearing a mask helps. And although masks aren't perfect, they don't stop all of the virus particles from going into your lungs or leaving your face. They're the best thing that we have, so we need to use them. And we need to eliminate the stigma that masks carry with them. There should be no stigma. We want to erase that stigma. So the COVID task force it has already launched a social media campaign, and we think that this will help people to see others wearing a mask and to become comfortable with it. And the idea is wearing a mask is okay. And if you can't wear a mask, that's okay too. We shouldn't have any shunning going on. Just do what you can. So here's what the campaign is. We will be posting pictures of people in our community that you may recognize wearing a mask, and some of them will be having signs that say why they're wearing the mask and who they're wearing the mask for and what their reason is. And we want people to share these pictures so that lots of people see them. And the more people that see them, the more they'll get used to seeing people they know wearing a mask. So we think this will help remove the stigma of wearing a mask. We also think it would be kind of fun. So the pictures are interesting to look at. And if you see them on Facebook or Instagram, to follow the directions, we're also going to be having prizes for the wearing of masks. Now, I want to explain a little bit about that. The City of Watertown Council did authorize the expenditure of funds to help with this campaign. And the funds that the city is expending are going to be going into only our local community to help stimulate our economy. And this will be done in conjunction with our partners who are also providing funds to promote the effort as well. But your tax dollars will be spent to go back into our local businesses. And I want people to know that. What you can do, because as Casey said, you can make a difference. Wear a mask if you can, and don't shun those who cannot. And since you don't know who's who, just don't shun anyone. Follow the CDC guidelines. And if you happen to be an employer, ask your employees and your customers to wear masks and promote physical distancing. Provide hand sanitizer. Follow the CDC guidelines for prevention. And allow your employees to stay home if they're feeling sick. You can make a difference, and we want you to help. So we want you to stay strong, stay safe, and do your part. Thank you. Now Jennifer Bender has a few words.
Thanks, Mayor Caron. So I'm Jennifer Bender. As many of you probably know by now, I'm one of the public information officers for the task force, and I also serve as director of marketing for Prairie Lakes Healthcare System. So a lot of times I have two hats that I am, wearing at all times during this entire pandemic. So as Mayor Caron said, the City Council approved for their funds for the campaign, and specifically the funds from the city are being used to go back into small businesses. So for example, if you go to Facebook or Instagram, you will see that there are instructions to participate in a contest. And this week, it is $50 of chamber bucks for both Facebook and Instagram. So you can participate in both and increase your chances, by the way. So those funds are going into those chamber bucks, which are going back into our community. Now, partners like Prairie Lakes Healthcare System, we find it to be very important to try and spread the word and reach people beyond just those pages, people in our community that don't just follow those accounts. So we are paying for ads to reach people outside of that page reach. So I know a lot about Facebook algorithms, and I can tell you it's very essential to reach people beyond just those who are following us on those pages. So together, the task force, it's not just the city, it's not just Prairie Lakes, it's everyone who's a part of this task force thinks it's very vital to reach people in our community and encourage mask wearing. Now, it's not just mask wearing. Mayor Caron and both Casey talked about a lot of the precautions that we need to be following, and the more precautions you use in your daily life are going to add up. They add up and increase your chances to preventing spread and helping us mitigate this disease. So thank you everyone for listening, and we are going to open it for any questions from the media. No questions today? All right. Thanks you everyone for tuning in. Go out and find us on Facebook and Instagram, and we will see you again if we have another update. Have a great day.